Good afternoon, everybody, and thank you very much for your patience. Our apologies. We've had a few small IT hitches that we've just been correcting there. So apologies for being a few minutes late starting this morning. So welcome to our webinar on making a good management referral. My name is Matt Higginson, and I'm the Clinical Operations Manager for Insight Workplace Health. And it gives me great pleasure today to introduce one of our clinicians, Alison Webb, one of our experienced occupational health clinicians, who's going to introduce today's topic, which we're hoping you'll find of benefit for yourselves and your employees in the workplace, and help you engage with ourselves effectively and to utilize the services that we provide over the coming weeks and or months. If I can ask just a little bit of housekeeping, if you can please keep your microphones on mute. I'm aware that sometimes people may be in busy offices, and so if you can avoid distractions for those who may be speaking. If you do obviously want to ask a question, do please use the chat facility. That will be being monitored by our IT team, and they'll obviously forward those questions to Alison for her to consider towards the end of the presentation. We do hope you really enjoy it, that you do engage with ourselves and ask any questions that might be pertinent to your own workplace. Obviously, if you can, obviously from a GDPR perspective, do make sure that you're asking general questions if you've got any particular concerns about types of cases or types of information. So without further ado, it gives me a great pleasure to pass you over to Alison. Thank you very much, Alison. Cheerio.
Thank you, Matt. All right, okay, so as you know, I'm Alison. I'm one of the occupational health advisors here at Insight Workplace Health, and I've been invited to come and walk you through how to make a good management referral. So to start with, I think it's important that the correct approach, when you're looking at making a management referral, that the correct approach is taken. And what I mean by that is then sort of, following the policies and the procedures and using the tools that have been provided by your business, as that is going to help to maximize the value that you're going to get throughout the process and the subsequent occupational health report. And if we look at this a little bit more closely, that can be achieved. So if we look at the process, it can be broken down into some discrete steps, which I'm going to give you an overview of on the next slide. If we have a look, so the first step of the process is looking at the reason for the referral. So, you have an employee that's presented with a health issue, and you've got concerns, and you're thinking that you need to have a conversation with them. It may be that they're absent, it may be that they've got a lot of short-term sickness absence, so you're wanting to make that referral, or thinking about that there is a substantial reason that needs to be referred on to occupational health. So it's really to be clear on why you're making that referral. So looking at the reason of why you want to make a referral to occupational health. Then the next step of the process is looking at consent. So the what we mean by that is having that conversation with the employee. So being open and transparent, and being and ensuring that the employee is a willing participant throughout the process, because that's going to be key in helping again to get the best from the referral and the report, subsequent occupational health report. So if we follow that on, the next step would be then to have a conversation, again looking at writing that referral and providing clear and relevant information, and making sure that the information is accurate. So again, if we look at the next stage, it will be looking at the consultation itself, and that's where there would be a guided interview from an occupational health practitioner to gather relevant information to provide appropriate advice to yourselves. And then that will lead us then to the report, and the report will concentrate on the information that will be deemed suitable and useful to provide back to yourselves in order to make decisions to help support your employee. And then the last step of the process is the review. So as a manager, taking the responsibility of the occupational health report and looking at future actions using the guidance to help move the situation forward. So that's the process of making a management referral. But if we then sort of look at each of these individually in more depth, it will give you a little bit more of an understanding. So if we look at the reason for the referral, there are two main reasons why you may refer an employee to occupational health. And it usually starts with an employee perhaps that you're aware that they've got a health condition that's affecting their performance in work or is affecting their ability to be in work. And what we're looking at is then that they may, it may be that their fitness is affecting their work. So they've got a condition that may be affecting their ability to carry out all the aspects of their duties, or it may be that work is affecting their fitness, so they perceive that there's something going on in the workplace that's affected their fitness to be in work. So when we look at that, that can be broken down a little bit more. So as you've probably seen when you've been doing the referrals, there you may be that you've got an employee who's having a lot of short-term sickness absence that's raising some concerns, and you want to improve their attendance in work. And it may be that you want that to be explored further to be sure whether there's any underlying reason for the frequency of their absence. Then if we take that looking further on across the page, we're also then looking at long-term sickness absence. So somebody that may be away from work, you were hoping that they were going to be back, but there's no sort of clear timescales, and you want to make that referral so you can get a little bit more information to help you manage your department, or manage whilst they're still absent, putting measures in place and looking at really sort of what you might need to be thinking about for getting back to work, where there's a possibility that a return to work could be expedited by looking at adjustments that could be offered to help them return. And again, it may be that you've got an employee who has discussed that they've got a newly diagnosed condition, or they've got an underlying health condition that's been managed really well and they're having some issues with. So again, it may be that you want to then think about making that referral so you can get a little bit of a better understanding of what's going on with that health condition, what that means with regards to their role, and how or what may be able to be put again in place to help support them to remain in work going forward. Again, often there may be that you've got an employee who's waiting to have surgery, and you might want some advice to look at how you can support them to stay in work. Or it may be that you want some guidance because you're being proactive and you want to understand what you need to be thinking about when they do go off to have their surgery. How long will they be off, and whether there's any guidance there for timescales, so you can plan ahead. And again looking for what maybe need to be implemented on their return to work. And then obviously you may also have an employee who's presenting with health issues around their mental well-being, and that may be that they've declared that they're feeling stressed at work. They may perceive that there's some workplace stresses, or it may be that they're having a difficult time at home, some personal issues, or there's been a bereavement. And again, it's looking then to get guidance to either support a return to work, or look at adjustments that can be put in place, or what to do to help perhaps look at some resolution around those workplace issues. So that's sort of looking at the reason for the referral. So if we sort of then move on, the next stage of the process will be looking at consent. So again, we've talked about consent at the beginning when we were just giving the overview of the process that you go through. And consent, really what we recommend, certainly we advise and we encourage, is that you have a frank and timely discussion about the reason and the purpose for the referral. So it's in my opinion, it is key that there's openness and transparency when you're making that referral. So including the employee in every step of the process is going to get the best out of that referral. It's going to help ensure that they are a willing participant engaging with the process from the start to the finish. Okay, so if we then sort of then look at that, move that on forward, it's important again to have that conversation where you're explaining the procedure. So what the steps are for the employee when you're making that referral, discussing the information that you want to provide to occupational health, and looking at the questions that you want to ask of occupational health with the employee, to again making sure that they are being included to enable and ensure that you're getting informed, they're able to make an informed decision when they're giving consent for that referral. One of the important things here is that obviously making sure, you know, probably talked about is the transparency and openness again, because that leads back to making sure that if they are feeling valued and part of the process, then it is going to get the best out of the referral along with a subsequent report. So if we move along again to the next stage of the process, which is making the referral. So that's when you're actually sitting down with the employee. It may be that you've discussed the referral with them because they're at home and you're not able to do it with them. But again, it's about that transparency, being open and discussing the reasons for the referral, making sure that the information is correct and it's accurate. You know, so when we talk about sort of making it about the employee, it's making sure that all those contact information that's provided on the referral is correct, because otherwise, unfortunately, that can delay the process. Because if we're, you know, our team are trying to get hold of an employee, but we haven't got the correct contact information, then it will delay the process. So again, in that referral, when you're making the referral, be clear about the reason for the referral, and then provide the background to any of the issues that have led up to the referral. You know, just a summary of what's been going on, and again, sort of it will, you know, it's great not to have any surprises in that, because sometimes when we do a consultation, there are times when there'll be a surprise and we find out there's been some grievance or complaints, or there are performance issues. And if we know that beforehand, we can prepare for that consultation to expect that there may be a little bit of distress, maybe a bit of anxiety. And again, we can talk about those issues and how they may be affecting the employee, because they will be factors that are likely to be contributing to their health. So again, those kind of things are really important to be aware of. We don't need you to go into detail about what it may be. We just need to know that perhaps they're on a performance management plan, that there's a grievance in process, or there's disciplinary process being moved forward. That's really all we need to know, just so we can be aware what to discuss with the employee and what kind of things we can be thinking about with regards to support and prepping for that consultation. And again, then when you're sort of doing the referral, it's important to have a look at those questions. So your business will have a standard form that they're using for you to make that referral, and on there will be some standard questions. Additional questions can be asked, but what I would advise is that they're, you know, kept to the minimum, because if there's a lot of questions, they will not necessarily all be answered, because there will be time constraints with the appointment. But again, ask yourself when you're thinking about your additional question that you want to ask, is it something that's already been asked in one of the standard questions, and therefore that standard question will meet your needs. Okay. And again, it's then looking at consent, making sure that you've discussed that referral, what you've written in that referral, and again, checking that the employee consents for that referral to be, and that information to be shared with occupational health. Because again, that's an important part of making sure, again, that they're happy with what's being sent. So if they're not, then those conversations can be undertaken with yourselves. And again, that then makes it much easier when we move on to the consultation, that there's no hidden surprises for the employee when we're reading what's been put in the referral to us. Because again, that can then cause delays with the referral. And again, if they say that they haven't consented, it means that we can't proceed, and that the referral would then have to be referred back to yourselves as managers for that conversation to be had with the employee. So it's about just trying to make the process much smoother by making sure that you've discussed and you've got the consent. I appreciate sometimes it's not always easy to get hold of employees if they're absent from work. But I would probably say to explore options around that. Look at whether perhaps a telephone consultation could go with where you read the information, or an email is sent with the referral so the employee has a copy, or it's sent to their home address so they can see what's written in the referral. And again, it's all about being open and transparent, and making sure that there's no hidden surprises for the employee along the way. So if we again then move on, we're looking at the so again, to do a recap, so making the referrals just be about being concise, comprehensive and accurate, making sure those telephone numbers are there to make sure that we can proceed without any delays. Okay. So when we move on to the next stage of the process, it's then you submitting your referral, and it's when the referral comes into occupational health, it's then triaged by one of our occupational health clinicians. So they will look at the information that you've provided, and they will make a balanced judgment on that information. So the consultation for the employee can be arranged with an appropriate clinician. So it may be that if the information provides indicate that it's a little bit more of a complex case, it may be deemed necessary for the referral to be put through to one of our occupational health physicians. Or it may be if it's a complex mental health issue, we do have a mental health practitioner within the Insight Workplace Health, and it may be seen that referral needs to go through to them. Otherwise, it's usually put through to one of the occupational health advisors. But Insight, we're pretty good at looking at the skills of our clinicians, backgrounds, and areas of speciality. So again, when that referral is being directed to one of the clinicians, it's taking all of that into account as well, so we can make sure that we're getting the best from that consultation for the employee and for yourselves. So when we look at then the consultation itself, we're looking at our admin team have made and arranged an appointment with the employee, and then there are responsibilities with regard to that. So when we sort of talk about that, it's really sort of making sure that when that agreed appointment, the time for the appointment, the employee makes themselves available for that agreed appointment time, that they're timely. So if they're attending and they're having a face-to-face consultation, then they're making and giving themselves time to attend the location where that's to be held, or if it's a telephone consultation, then it's really important that they make sure that they're in a safe environment that is conducive to sharing sensitive health information. And there have been many times when I've taken a consultation or tried to take consultation where we've had somebody driving. Now, we will give them the option to call them back within 5 minutes or 10 minutes. So if they can pull over and find somewhere safe to be able to take that consultation, then we will look at giving that as an option. But again, if they're on a train or in a supermarket or in a cafe, if they can't move anywhere which is more conducive, then unfortunately that then sort of leads down to the breakdown and the consultation has to be abandoned. And again, then that causes delays. So what I would say is when you're having that conversation about making the referral with the employee, have that conversation about making sure that they're in the correct environment to undertake the consultation if it's on the telephone, or that they allow themselves enough time regarding traffic and things if they're having to travel in to one of the clinics for their appointment. And again, it's encouraging them that they're going to be ready and able to engage in the process. So if we then move on, the occupational health advisor or practitioner also has their responsibilities when it comes to undertaking the consultation. And, and again, our responsibility is to make sure that we're in an environment where it is conducive to have that conversation with sharing sensitive health information. And again, what helps with the situation with a consultation is if the employee has been fully engaged right up to that consultation, they're fully aware why they've been the reason why they've been referred, the manager's discussed what they're hoping to get out of it, then it helps us build up a rapport more quickly than if we are then sort of dealing with information that's been included that they've not been aware of or they're not happy with, and therefore it just takes a little bit longer then for us to sort of move things forward, and again obviously making sure that they're happy and consent to proceed. Again, we also then sort of like go over the referral form with the employee, again making sure that they understand the reasons for the referral and that they can consent to continue with the consultation, before then starting to sort of gather information regarding their medical history, so we can then start looking at that with regards to work. Again, you know, what we do in clinic sometimes will be different if it's a consultation over the phone. So it may be if they come to clinic, the clinician can obviously see and look and start doing a functional assessment before somebody or somebody's entering the consultation room. But over the phone, we are then sort of directing questions so we can get a good idea about their functional ability, so we can then start looking at that with regards to work. So we may be asking lots of questions about things that they're doing at home life. Sometimes I explain, you know, it's not me being nosy, it's just that I am trying to get and establish an idea of how their condition might be limiting their ability with normal daily life, so we can then sort of equate that with their job role and duties. And then again, like I spoke previously about, if we've got an idea and we can plan ahead for the consultation to start with from information provided in the referral, we can be looking at kind of things that we might be thinking about with regard to guidance and information around self-care to help promote their well-being, and again looking at possible other supportive measures such as charities where they may be able to get further supportive intervention, and discussing maybe some of the outcomes from medical appointments. You know, we appreciate in occupational health that sometimes, you know, employees feel rushed when they're speaking to consultants or GPs, and sometimes they want just a little bit more clarification or understanding, or somebody just explaining a little bit more about their health condition. So we do try and give some feedback to the employee, or explaining things if that's required. So with the consultation then, it will lead again on to us writing a report, and towards the end of the consultation, the report will be discussed with the employee. We will give them an idea of what's going to be included in the report, but the aim of the report is to provide information on the employee around what they can or cannot do with regards to their job role. So it's looking at things, whether there's restrictions that are required, or whether there's some workplace adjustments, again, that you can then look at and see whether they can be implemented to help support your employee within their role in work, or again, looking at whether there's an option to get them back to work a little bit earlier if adjustments can be put in place. So the employee, again, coming back to consent. So you'll probably see there's a bit of a theme here because we keep reverting back to consent. And again, you know, it's important that the employee, we check with the employee that that we've got their consent throughout the process. So again, we're talking about the report, and we will explain to the employee that they do have the option to have a copy of the report, that they can see the report before it goes back to management, and right up until the report goes back or is sent back to manager, they do have the right to withdraw consent. So we do explain that, and again, we will explain the outcome, that if they decided to withdraw consent, what that would mean for them with regard to being managed within the business. So as the occupational health advisor, we have the, like I say, we have the responsibility to explain what will be released in the report, and making sure that the employee is happy with that. We don't need to necessarily put in what the diagnosis is. You know, often we find the referrals, a lot of employees want the manager to know what it is, but we don't tend to focus on that. We are focusing more on what their functional ability is with regard to their job, and that really will be the key thing in the report. Is we may give a little bit of background information with regard to the health condition and what treatment, but then the main focus really needs to be on their functional ability, so whether they can actually return to work. And that's where we put in our opinion. So we're saying what we think from the information that we've advised on their fitness to return to work. You know, there are times when we'll have an employee who won't, or perhaps doesn't necessarily agree with our opinion. And again, we would put that in the report to yourself, so you are aware of that. So if we felt that we could expedite or get somebody back to work a little bit earlier, but they disagree and they want to stay off because their GP assigned them off for another 2 or 3 weeks, then we will say that, you know, we do feel that if they're willing, the return could be brought forward. So when it comes to the report, we also explain to the employee that any factual errors that are highlighted will be corrected, but we cannot make any corrections or any changes or alter in any way the occupational health practitioner's opinion. So, but you know, usually that will all have been discussed at the end of the consultation. So it's, you know, certainly from my point of view, it's usually unlikely that we get anybody come back asking us to change our opinion. It's usually that they haven't, like, you know, the employee hasn't quite understood our wording, or they don't like the way we've worded something. And again, you know, we're all quite reasonable. We will make changes if that's the case, as long as it's not, you know, doesn't change the response in the report or the outcome of the report. And then any additional information. So if an employee comes back and says that they've been to see their GP and they've got some other information and they want that to be included in the report, it can't be included in the report. What's in the report is what's been discussed during that consultation. We can't add anything else in because it does need to be discussed at that moment in time for it to be included in the report. And again, any additional questions, so after the consultation, really can't be added or addressed, because again, it needs to be discussed with the employee, and we need to make sure that they're fully engaged and are aware of the response that's going back to the business and give their consent to do so. So if we move on to the next slide, we're looking at reviewing the report, and that's when we start handing back over to yourselves as managers. So, you know, so the responsibility will be then when that report comes back in, that you review the situation in light of the written advice and the recommendations provided in the report. Again, it's, you know, ultimately the report should enable you to move the situation forward towards a successful conclusion. So hopefully that will be either keeping somebody in work with the support of workplace adjustments, or actually getting somebody back into work with the support of some temporary adjustments. And then it's also useful to review and discuss the contents of the report. So that's, again, one of the key things that I feel helps facilitate a successful outcome, is actually arranging to have a meeting and sitting down with your employee to discuss what's been written in the report, the adjustments that have been recommended, and again, you know, sort of working out with the employee what can be accommodated within the business, and, you know, exploring whether there are any alternative options if it's not felt that some of those recommendations can't be supported within the business due to business needs at that point. And again, it's, you know, it is a management decision, so we do explain that to the employee when we're doing the report, that it is a management decision whether the workplace adjustments can be accommodated. And notice sometimes when you have a report back where there is a case that perhaps is a little bit more complex, somebody's, as you progress through the consultation, they've got multiple health issues, and it's a lot more complex than the referral, which seemed to be from the referral, then there will be comments where we may suggest that a review would be beneficial with one of our occupational health practitioners, or we may suggest that a case conference would be of value to help sort of move the situation forward. So whether that, is that we all sit down and we work out things that may be possible. So from a medical point of view, we may come in and look at what can the manager or the business look at supporting, and there may be that we can explore ways around that to move things forward to have the best outcome for everybody. Okay, and then we go back to our process. So starting back at the beginning, the steps of the occupational health process, there are times when we'll recommend for a review. But again, like I said, I think here is the key to help get the best from your management referral is to look at breaking this down and getting the best from your referral. Okay, so I hope I haven't talked too fast. I've tried my best not to. I get a little bit passionate sometimes. So are there any questions?
Can I ask a question, Alison? It's Nicola Eccles from Conway County Borough Council.
Yep.
Sorry, I missed the beginning. I do apologise. I had terrible trouble getting in, but I caught the bit where you said about the consultation and possibly coming into the clinic. I've never had that option in all the years I've worked with Conway. It's always been a telephone consultation, shall I say. So I was just wondering if there's any more details around that.
Right. Okay. I would probably, I don't know if Matt's there. Is Matt back? I was going to ask Max, I don't know whether, all I can say is that I don't know whether that may be what the Conway County Council have bought into, whether that's what's limiting. And I was hoping that Matt might have returned because he may be able to answer that better than me as the operations manager. But I'll make a note of that, Nicola, and I'll see if one of our team can get back to you. Or it may be that when they've been triaged, that may be the reason that they felt that a telephone consultation would be good enough, that they don't need a face-to-face, because that's usually now it is a lot more moving towards telephone consultations, but there will be times, even as a clinician, we'll say that actually a face-to-face would be better. Again, obviously we do now have the option of doing video calls, so again that may be why Conway may not be, and I'm thinking, is Conway North Wales, if I got that right?
Yes.
So that I don't know whether that
it could be location.
I was going to say that I don't know whether location may come into it, because obviously you're thinking then about getting people to travel. I know that we do have a clinic up in North Wales, but I don't know how far then again still that may be. So it may be that it's I know that video sort of calls are now becoming a more option, but again everybody needs to be sort of computer savvy, don't they? So
no, that's fine, thank you.
That's lovely, no problem. So anybody else, any other questions?
Can I ask something? With getting consent, particularly from people who perhaps have got anxiety and mental health problems, and particularly when stress and stress that's work related makes them fearful that actually the reason for a referral is because you want to get them out of the organisation or whatever. Obviously, we've suggested to people that they can opt out at any time. But have you got any other advice about how we can actually encourage somebody that going through that process when they're particularly anxious about it or particularly fearful would be beneficial in the long run?
Okay, yes. So that's quite an interesting one. I think that's where, it's the openness and the transparency. So sitting and doing it with them, making them feel that they're included. I'm hoping then will make them, and looking, and they can see, or they've had a copy if you've been going through the referral with them, because I appreciate you can't always have them sat with you nowadays. Hopefully that again will help to alleviate some of that anxiety. And I think it's just, you know, as well as explaining to them, or whether you've got somebody else that you may be happy to say to them, well, I've had an appointment with occupational health, and actually, you know, I really found, I was nervous and I was anxious, but actually I found it really helpful. You know, so that could be something that you could explore, whether that would be helpful, just to help alleviate that. Again, it may be that, you know, the employee's happy for you to put that in the referral. You know, I often do consultations where I can pick up that somebody's really quite worried, you know, even on a telephone consultation. You know, we've had enough experience now where you can pick up a little bit of a wobble in a voice, a little bit of tension, and I will start off explaining that, you know, that what my role is, and that my role is here to actually look at how I can help them to get better, to return to work or to stay in work, or, you know, particularly, you know, I think even with grievances and disciplinary, you know, we are all quite skilled at giving advice on how to help them manage those anxieties around that once they've got into that consultation. And I think it's, again, that's where I'm saying that, you know, if there's open and transparency from the start, when we get to that consultation, it allows us to build up that rapport, and again, you know, sort of hopefully put that person at ease. You know, sometimes it can take longer. There are times where you can see, as the consultation's going on, that the employee, you can feel that they're getting more comfortable, they start talking a lot more freely. So that's the only thing I can say, is just, you know, to guide them and make sure that they feel that they're included, you know, and explain to them this is not about getting you or shoehorning you out the business. This is about looking at how we can support you in work or get back to work. And I think, you know, that's, I hope I've answered your question.
Yes, thank you.
Okay.
Can I ask another one, sort of on the same kind of basis, that if you've actually at that point persuaded them that actually it would be a good thing, but then it's got to the point that right at the very last minute they decline for their outcome to be shared, so the occupational health report, if that referral was to try to get them back into the workplace, I mean, you know, obviously that's what we want out of most of the referrals anyway. Obviously you can't share that they any of that report because you don't get to see it, but how do you get over it being perceived as a negative thing that they've not then wanted it shared, especially if that leaves you not knowing whether that person's fit to come back to work or not?
Right, that's quite a challenging question.
Sorry. You seem to have some quite challenging scenarios.
I guess really it's whether they would be happy to engage with occupational health again, whether, you know, is there something particular in the report that they don't want shared? You know, I have to say, it's been rare that I've not had a report, an individual consent for a report going back. So I would say that, you know, if you've had that experience, my question would be, what is it that they don't want to be shared within the report? And maybe it's then, has occupational health suggested another review? So would another review be beneficial in exploring what it is or why they don't want to? But again, they're going to then need to engage in that consultation. You know, another option around it would be for you as a manager, perhaps to have an informal chat and say, well, you know, because we explain to them that they will be managed without that information if not. So again, if we want to get over that, particularly when it's with mental health issues, you know, it's looking at, you know, would they be happy to have a meeting with yourselves to discuss that? And would they be willing to share? Was there something about the consultation that upset them, or the report? They don't have to give you detail, but then if you know that, then perhaps then you can come back to occupational health. And like I say, a review may be then something that could be an option if they're happy to engage with that, to explore what it is about the report, you know. that's the only, I think that's really the advice I would get. And obviously if they're not, then it is really about proceeding without that information, unfortunately, because we do need their engagement and their consent. So, okay.
Thank you.
Any other questions? Nope. I don't know. I'm going to see if I can be clever. So just bear with me. I don't know if there's any. So is Matt or Tim there?
Yeah, I'm here. Tim's here.
Ah, Tim, right, okay. I don't know, are there any other questions that have come through or that I might need to respond to, is what I was going to ask? Just trying to work out where I find them on here.
No, there's nothing else in the chat box.
Okay, that's lovely.
Again, I want to apologise for any technical difficulties that we've had. Different links, and we're working for some people and not for others.
Yeah.
But the recording should be available later this week for everyone. So anything you have missed will be available to you anyway.
Okay. All right then, that's lovely. So thank you everybody. Thank you for coming in and listening to me. I hope I've given you some useful advice to take away with you. And again, if anybody does have any questions that they may have, you know, please feel free to send them in to our operations team. I'm more than happy to address them. Okay. Thank you.
Thank you.
Thank you. Bye. Bye.
Thank you.